We still have, I think, pockets in rural areas of individuals who are less inclined to be vaccinated. And so I think that's an issue. We see that those who affiliate with the Republican Party have been a little more hesitant to get vaccinated. We've talked about that before. Unfortunately, things have gotten politicized around these public health issues. So we've tried to address all of those issues. Again, when you have one-on-one conversations, a lot of those barriers fall down. That's exciting, but one-on-one conversations are time-consuming, and there are thousands of people you have to have conversations with. So we're trying to meet everybody where they are, understand really what their concerns are about vaccine, what they've heard. Invariably, the people being admitted to the hospital have not been vaccinated. That's just well over 95% of the admissions are people not vaccinated. Now, occasionally we have a vaccinated person who has to get admitted. And I've had one of those in someone who has had an organ transplant and is on a lot of medications that suppress their immune system, had been vaccinated, trying to be incredibly careful because they knew of the risk to them, and still, for unclear ways, got COVID and had to be hospitalized. So those are the tragic ones. People are really trying to do the right thing, getting vaccinated, but not everybody responds equally to vaccines. So that's an issue. So invariably, it's people that haven't been vaccinated. It's skewed a little younger recently. To Dr. DeVay's point earlier, people in his community have been vaccinated. You see there's a very high vaccination rate in those over age 65 in the state of North Carolina. That group of individuals really stepped up and gotten vaccinated. So we see less of that as a percentage of our admissions. We see younger people having to be admitted, often with comorbidities. Other chronic medical problems are part of that story as well. Because they're younger, we have fewer people that have to be on ventilators, which is great. But we just think, if you'd been vaccinated, you wouldn't be here at all. So that's kind of what we're having to work through. Actually, I saw a slide recently from the state level that showed that Novant Health was #1 in the state in terms of having practices with vaccine in them. And Megan, you can correct me on this. I think it's 70 practices. So we were literally #1 in the state in terms of locations that had vaccine within practices. So that's exciting. Some logistical things we have to work through with that, get the practices up to speed, but we really, really believe in that. That's the future of COVID vaccination now and potentially when boosters come along. So our practices and our physicians and APPs and nursing staffs and other teams have all stepped up to provide those vaccines within the practices. So that's going very well, and we'll continue to expand that. And hopefully we'll get to the point where we're vaccinating children under 12, and then we'll be expanding that further into other pediatric locations and those kind of places.